By trying too hard to teach medicine, we don't train doctors. 40 years later, this sarcastic comment from Professor Hamburger is still true. Despite a minimum of 9 years of studies, French med school preparation is completely theoretical. Ask a young graduate to explain how the local Social Security office works, the cost of an MRI, or how to inform the patient of cancer. Becoming a professional takes years of practice. No wonder that the average GP in France is 39 when he or she opens their office. By comparison, the training of future lawyers seems a dream. To learn their profession after law school, they spend 18 months in another school with a professional aptitude examination at the end. Selection is another problem for the physician. From the beginning to the end of their studies, med students are evaluated on paper rather than in the presence of a patient. What are the criteria for becoming one of the happy 15% from among the 50,000 students in first year that go on to second year? Memorization and luck. At the end of the whole cycle, the National Classification Exam is no better in detecting the qualities that future physicians should have. For those who are rejected after the first year or later, the waste is tremendous. Some go into exile. The University of Cluj in Romania has 300 French students. All were selected on the basis of an application and the ability to pay 5,000 euros per year versus 250 in France. Is this a one-way trip to Transylvania? No. Having been rejected for medical studies in France, these same physicians will return to France to practice with their foreign diploma given the lack of physicians. Another aberration. While 50% of students are headed for general practice, this discipline is neglected in French medical school. The teacher-student ratio is 10 times lower than for other specialties. Patients seen in hospitals by students are not the same as those the young physician will see in his or her office. With specialists comprising 50% of the graduates, the system is not answering the needs of the population. In his report on liberating growth in France, Jacques Attali in 2008 recommended a ratio of 80% of GPs. Has Canada found the solution? CanMeds revolutionized medical teaching a long time ago. An oral exam helps the examiner get to know the candidates. A psychological profile is established in order to better orient the young students. The physician has a pivotal role as a medical expert, but also a communicator, a colleague, a manager, a promoter of health education, and a learned person who teaches others, as well as a professional who respects ethics and norms. When will we see a made-in-France version of this 21st century medicine?